to get down to the core of the agenda anyway, so I think we'll be okay. Is that agreeable?
Yes.
Okay, then I'm going to call this meeting to order. And if you would join us in the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Sheila, if you would call the roll, please.
Yep. Okay, I'm trying to get my headphones. Here we
Sure.
go. Mr. Furman,
Here.
Dr. Taub,
Here.
Dr. Hans,
Here.
Mr. Landsman, Miss Mamie Dyer,
Here.
Mr. Torres, Mr. Lindemeyer,
Here. Here.
okay. Dr. Guadalupe,
Here.
Miss Newman, Miss Summers.
Here. Thank you, Sheila. Are there any additions, changes to the agenda as presented? Hearing none, is there a motion to approve the agenda as presented?
So move.
Thank you, Steve. Is there a second?
Jonathan will second.
Oh, welcome, Jonathan. Thank you. All in favor, please say aye.
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 Any opposed? Okay, we'll move on to public comment. Do we have any this evening?
We do not have any public comment. I do want to remind everyone that if you would like to make public comment tonight, you can type it in the chat. We also have options available on our website through an online form. And then our standard practice is that we will respond to the comment via our customer services department.
Okay, thank you. That's always a good reminder. The next item is our consent agenda. Is there a motion to accept and approve the items as presented in the consent agenda?
Yes, I will. Jonathan will make the motion.
Thank you, Jonathan. Is there a second?
Second, Steve.
Thank you, Steve. All in favor, please say aye.
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 Any opposed? Great. We'll move on to our agenda proper. This is our opportunity to hear stories that inspire hope. So Christine, please.
Let me turn my camera on. Good evening, everyone. As you know, I think it's been a little over a year now. The board asked if we could incorporate Stories That Hope into our board meetings on a monthly basis. And Vicki was put in lead of the project, and then Trish and I joined her. We meet every November to work on a calendar for the upcoming year, looking at national observances and other things that are going on with our organization. I usually get September because September is Recovery Awareness Month and Suicide Awareness Month. I hope you were able to review and see some of the press releases we have put out in the last couple of weeks. So joining us this evening is Sarah Monday, and I'm very glad she is here with us. She has this great effervescent and bubbly personality. I'm going to ask her to turn her camera on. She's kind of new to Teams, but she and I practiced a little bit prior to the meeting, and see if she can unmute herself as well. Sarah?
I think I figured out how to do that.
Well, we definitely can hear you. There you are.
Can you guys see me?
Welcome.
We do see you. So go ahead, Sarah. I'm going to turn it over to you.
Hi, everybody. My name is Sarah Monday, and I'm a grateful recovering alcoholic and addict. Hopefully my story, I was asked to share my story of my strengths, hopes, and some of my downfalls, and what got me to the place where I'm at today. Right now, I am currently the secretary for Drug Free All Stars. And if you guys have any questions about that, or I can fill you in a little bit after my story about what we do, and either for ourselves, for recovering addicts, and families and people in the community with that too. So hopefully I don't go all over the place because I am severe ADHD. I will try to keep it short, simple, and sweet and to the point. If I do kind of squirrel off, just kind of be like Sarah, right here, and hopefully I can get back to that. My first recovery date was July 14th of 2015. I have always struggled with alcohol since probably the age of 14. As you can tell, I'm severe ADHD. Alcohol, to me, what it affected it on me was it actually slowed me down. It actually made me feel somewhat normal, where I was able to walk into a room and have a normal conversation and not feel either like the outcast or that I was feeling not myself. So I thought I found this miracle thing, and I also liked the taste of it too. So besides trying to be put on Ritalin and the numerous different medications from the ages probably of 5 till I think my mom finally stopped when I was, around the age of 14. I literally had the ups and downs, the escaping thoughts in my head, the different numerous times of suicidal attempts. I was a huge cutter. And when I found alcohol, it made me feel as I was able to feel somewhat normal, if that kind of makes sense. I wasn't needing to hurt myself, but I didn't know I was hurting myself in other ways with using alcohol. My father is an alcoholic and still is. So is my brother. And it got to the point where it was a natural thing. I was around it all the time, and it was very accessible and very easy for me to get to. Towards my high school years, drinking only was like on the weekends, a social thing, or what if I knew I had a big project or something coming up or a big test, I would always drink and cram the night before, and then hurry up and drink before I went to school, so I was able to concentrate on what I was doing. It came to where I was just doing it once in a while to where I was doing it every single day. It got to the point where I was starting off with a fifth that I would have in my backpack, and I would hide it. And then I was doing it at school, and it just progressed. And then I found out I built up a tolerance. So I had to keep taking in more and keep taking in more. Then I was introduced to Vicodin, or Norcos, as some people call it now. And that took the pain away a lot faster. And I didn't have the hangover, and I wasn't smelling of alcohol. And I wasn't feeling the outsort. So it kind of like had the same effect as alcohol did on me when I was taking pills. So fast forward to drinking and then taking the pills, because people were starting to catch on I was drinking because I was smelling like alcohol. I was throwing up. My mom was finding empty bottles everywhere. It was really, really bad. So then I was like, ooh, I found this other drug. Let's try this. And I ended up getting injured playing basketball in high school. And I blew up my knee. And that was, of course, the medication they prescribed to me being 15 years old. I liked it. I liked it so much that I kept purposely re-injuring myself, so I would have to keep getting more. So I was purposely harming myself again. So back to when I was cutting, to when I started drinking, I blew up my knee, to getting prescriptions. So I was purposely either making myself fall downstairs or doing something. So I was breaking something or hurting stuff in my body. So I was able to get more narcotics. I tried smoking weed. Weed did the total opposite effect of me. Instead of mellowing me out, it made me extremely hyper. When I wasn't able to get the pain medication, I was actually introduced to a thing called cocaine. Cocaine, to me, I thought was the #1 fix-all drug. It calmed me down. I've heard stories from other people where it said it raced them up, it made them feel alive. This actually mellowed me out. I was able to stop, focus, and concentrate on either schoolwork or working or whatever kind of task that was thrown in my way. I was able to deal with and do. End up meeting this gentleman who, needless to say, I got pregnant And when I was 17 years old, I have a beautiful soon to be 21-year-old, and she literally saved my life. She literally, as I always joke around saying, she was the best 30 seconds of my life because I was extremely blessed to have her. And then I had her at 17, so I had to drop out of high school because that was looked against at the high school I was attending. I dropped out, got my GED, ended up meeting this other gentleman who, of course, I went back to doing coke after my daughter was a couple years old. She was almost 3. Went back to doing coke because I was starting to have urges again, and I know I didn't want to hurt myself because not only was I responsible for my life, but I was responsible for somebody else's life. And ended up meeting this gentleman, and I was working at a strip club. He walked in, and I was telling him like, "Hey, I'm sitting here working as a bartender. I can't really do this dancing thing, you know. I'm trying to support me and my daughter." And he's like, "Oh, really? How old's your daughter?" And I'm like, "She's actually going to be 3." He's like, "Oh, I have a 3-year-old too. We should get together and have a play date." Perfect. And come to find out, he was the one supplying all the other dancers and all the other bartenders there with coke. And I haven't had it in so long. And I was like, "Hey, I want to try a little bit of this." So I end up trying some. Needless to say, he became my super boyfriend. And I end up getting pregnant at 20 with my beautiful son. He will now actually be 17 in October. And yeah, I thought life was great. I was living in Grosse Pointe. I was a beautiful home, driving nice cars, 20 years old, almost 21. And I'm living life fast, and I have money, and I don't have to work. And I think I'm the coolest person in the world. Well, he became very abusive, and after I had our son, and pretty much wanted me barefoot and pregnant the whole time. He didn't like the fact that I was able to lose the weight, get makeup, start looking good again. Like I would run to the store, he would ask why it was taking me so long to get a gallon of milk, who was I seeing, what was I doing. And then towards the end of the relationship, it became physical. So me at that time, he went to work, I ended up taking my kids and leaving, and ended up getting sober. And stayed sober for a very, 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 very long time. Just found ways of working out, did meditations, deep breathing, did a lot of research on the ADHD, ADD thing, and figured out it was mostly mindset. So I was trying to retrain my mind on how to, take a couple deep breaths before I speak, and how to not interrupt people when they're talking. And if this is a way that I learn, then to be taught it this way instead of trying to cram books and stuff down. So I went back to Baker, and I got my EMT and medics license. I found out that career worked really, really good for me because it was more hands-on. I actually graduated top of my class with honors, walked across stage 4.0, and it was so nice to have my mom and my grandparents be in the front row with my daughter and my son, and then seeing me of the stuff that I went through, the achievements that I was doing, and were able to receive. In 2008, I was involved in an MVA, which is a motor vehicle accident. We were on 696 and 94. We were in an E2 call, and I don't remember much of the accident. I do remember they say we were approximately going between 88 and 92 miles an hour, and we were T-boned, and our rig flipped and hit the center concrete center wall. That's what stopped us. And the T-box, or our laptop that we called it, went into the lower part of my spine and pretty much jacked my whole spine up. So I ended up having to have major back surgery. That got me back onto the pills again. That's when I started doing the Norcos, and I was only doing it as prescribed. Well, the pain got really unbearable, and of course, people will tell you that you build up a tolerance. So instead of me taking 4 a day, I was taking 8 to 10 a day, and then I was taking 11 to 14 a day. Then I was taking 20 a day. It just got to the point where it was so out of control. July 14th, 2015, when I was finally made a decision to get sober, I was actually at a bar and hadn't drank in so long. And I'm like, I'm going to have a couple beers. couple beers, couple shots. I'm going to do this, go out for a friend's birthday celebration, and I don't remember half the night. I remember waking up at the police station and they saying that from the time I was there, my bar tab was over $70. And I thought it was for me and my friend I was with. Come to find out it was only for me. And I ended up doing 15 shots of Fireball and 4 32-ounce draft Bud Lights. And I don't even, now I think about it. And I end up getting into my car and driving across the street to the gas station and passing out at the wheel. But I did walk out on a bar tab. So when the cops knocked on the door, I was extremely blessed to have not been charged with OWI or a DUI or anything, but I was charged with walking out on a bar tab. So I had to go to court, got put on probation. They recommended AA. And I was sober for 6 years. My new sobriety date is March 25th of 2018. That was 2 days after I ended up losing someone extremely close to me, who I considered was my brother. He ended up overdosing. And I struggled with it really, really bad. Sorry. And I'm still struggling with it. So he passed away March 22nd of 2018. That night and the next day, I went out and I drank. And I drank to the point where I purposely drank to get blacked out because I didn't want to think or feel the emotions that I was feeling with. I didn't know how to handle them. I didn't know how to deal with it. One thing that I've always never been able to deal with are my emotions. I was always taught you don't deal with your emotions. You just suck it up, you put them away, and you move on, kind of thing. And that's been working so far for me, as what I thought. So like I said, my new clean date is March 25th, 2018. I'll be coming up on almost 3 years, almost 3 years. And I'm very extremely blessed and grateful for the 12-step program that I do work, and the doctor that I'm actually seeing who actually listens. Like I said, I've been to numerous doctors before, trying to explain what the thoughts that I was having in my head and the feelings that I was going through, and them either looking at me thinking I was trying to get something or making something up when I'm like, here, I don't need anything. I want to know how I can fix what I'm feeling inside. This is not normal thoughts I should be thinking. I did have a lot of mental and trauma and sexual abuse when I was growing up. And I pretty much thought that's how life was supposed to be. And then come to find out it wasn't. So needless to say, now I'm extremely grateful for where I'm at. I am actually a homeowner. I am actually a functioning member of society. I have a great relationship with my kids. We have 5 dogs. I own some cars. I have a beautiful life now that I would not trade for anything in the world. And I was given a gift, and I'm able to give it to somebody else instead of being selfish and holding it towards myself, because that's one thing that we are taught in this program is so freely given to us. And if you're able to help somebody else, give it back so freely. And when one of the big things that I'm with right now, like I said, is Drug Free All Stars. And that's a group where we are people in recovery, and we meet you at when you're in recovery. And if something happens, we don't, throw you away. We don't look down at you. We're very supportive, and we're there and we listen. So that's pretty much my story. Hopefully some of that made sense, you guys. Like I said, this is the first time I ever did a virtual anything. And actually, this is one of the first times I've actually shared my story. So hopefully I wasn't all over the place too much. And if you guys have any questions or want to know any more information about anything, you guys could either get a hold of me or let me know. Because like I said, we are here. We're always going to be here. And like I said, I am truly grateful and blessed to be where I'm at today. So thank you guys.
Thank you, Sarah. We surely appreciate your courage in sharing your story and your desire to help others. If there are any questions for Sarah, please say so, raise your hand or step up. Eric?
Hi, Sarah. Thanks for coming on today and telling your story. I've been in alcohol recovery for maybe 11 and a half years.
Congratulations.
You know, some of that story sounds familiar. I want everybody to know I've been aware and know of Drug Free All Stars since its beginning. I've been acquainted with Stacy Burns and the organization for a number of years, and they do really good work. They're in the community every day, working hard to help carry the message to people struggling with addiction. And it's a great organization, and everything that they do is always high quality of helping people recover. So I just wanted to mention that. Thank you.
Thank you, Eric.
Are there other questions or comments for Sarah? Malkaya?
Hi, Sarah. It's not really a question, just a heartfelt thank you. I'm also a person in recovery from mental health condition, so I know how challenging it can be to share your story with others. But I do it because I know that it gives somebody else hope, and I hope that you continue to do the same. You're a beautiful young lady. You don't look like what you've been through at all. So I really appreciate you taking out the time to come and share your story with us, and I wish you every good thing that life has to offer you from this point on. So thank you.
Thank you.
Thank you, Malkaya. Are there other questions or comments for Sarah?
Yeah, I was going to say, and if anybody wants to know any more information about Drug Free All Stars, we do have a Facebook page. We do have a website. Our website should help. Actually, we got a grant from Medosa, and they're actually working on improving our website right now. So hopefully that'll be up and running here in a couple of weeks. But we do have a Facebook page, and we do have a hotline. So if you guys want any more information, whether it's due to recovery or mental health, or even prevention, like we hit all areas. So.
Thank you. Vijaya, did you want to maybe share your comment?
Yes, I wanted to thank Sarah immensely. Her story is so powerful and so inspiring and so full of hope. I now have a very favorite nephew who has been struggling with addiction for the last several years. Unfortunately, he is out of the country, but I think, and I recently have started losing hope about him because he makes one step forward and two steps back. I have been trying to support him from a distance and was starting to lose hope because now I can't travel, he cannot travel, he can't hold a job. Brilliant student, but somehow, addiction is addiction. And Sarah's story gives me hope. So thank you for sharing.
Thank you. Yeah, and what I tell people, especially family members that are dealing with people who are still struggling in active addiction, don't give up hope. Don't give up hope, because like I said, I've fallen down so many times to the point where my family was about ready to, my mother was about ready to pull custody paperwork of my kids, because she's, yeah. And we now actually have a very, very good relationship. I call mine and her relationship like Mr. Jekyll and Mr. Hyde. We can't be in the same room with each other because we'll probably end up killing each other. But we've actually come to a point now where we can actually be in the same room and actually have a normal conversation, and the trust is starting to get back and the communication is starting to get back. And it's very, very nice. I didn't have that for a very, 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 very long time. So like I said, don't give up hope, because like I said, it happens.
Thank you.
Are there any other questions or comments for Sarah? I'm not seeing anybody, but I'm not always the best at monitoring all this. Well, Sarah, certainly a lot of impact from your story, and I'm glad that your resiliency has had benefits for you in restoring your relationships and being able to share your inspiration with others is infectious. So thank you so much for being with us today. We really do appreciate your time and effort.
And thank you guys for having me.
Thank you. Okay. Are there any other, I don't want to cut anybody off if they have something that they'd like to share. Thank you. We'll move on to the next item on our agenda. Take care, Sarah.
All right, thanks. See you guys soon.
Next item on our agenda is the review of the July 2020 financials. Anya?
Good evening, everybody. Just verifying you can hear me okay.
So far, so good.
Okay. So we can go ahead and look at the July financials. So first, we're going to take a look at revenue. The revenue year to date, as we've been talking about, is higher than last fiscal year, mainly due to the eligibility trend, which you can see anything above that blue line going across is higher than what we received last fiscal year. We did have some adjustment to the rates, but the primary impact has really been eligibility. What you see happening there in June is that direct care wage pass-through payment. We will be seeing that again in September. But just the eligibility trend is continuing in the same manner we have been seeing it, which is definitely impacting our revenue. Moving to the next slide, please. So that's essentially what I just talked about, eligibility. You can see last fiscal year, we continued to see a drop through the fiscal year with the economy in the state that it was. But with the onset of COVID, you can see back there in March, it started to uptick and it continues to increase month after month. It is definitely at the highest levels we've seen it in a minimum of 2 years, probably longer at this point. So that has a positive impact on our revenue because we are paid on the number of eligible people in Oakland County every month. Moving to the next slide, please. So this document looks at assets and is a comparison of assets from the end of last fiscal year to the current period, which is the end of July. So as you can see, cash and investments has gone up. Receivables has gone down, just meaning that we have paid off some of our debt. Could be just claims and things like that. Much of that tends to be a timing issue. Other assets has gone down slightly, and capital assets has gone down slightly. And so what that's going to be is related to things like the building and any capital improvements. The value of them goes down over time. So moving on to the next slide. So now looking at liabilities, what you can see compared to the end of fiscal year 19 to July, our liabilities have gone down materially. So again, that has mostly to do with paying cost settlements and those types of things. Any accruals that were on the books at year end. At this point in the year, we've pretty much cleaned all of those up and made all of those payments. Due to state fluctuates really fairly consistently just because we accrue things on a monthly basis that we typically pay on a quarterly basis. So you'll see that relatively consistent throughout the year. Employee payables is up slightly, and then again, long-term debt is down. That's just us paying on the bond that we have for the Resource and Crisis Center and the bond homes that we own. So moving on, net position. So as you can see, compared to last fiscal year, our net position was, our total assets were about 82 million. Right now we're at 85 million, so that's going in the correct direction. Total liabilities is down, and net position, as you can see, is up close to $9 million. So doing well. We do expect a larger payment in September, as I mentioned, for the direct care wage pass through. And we'll very soon be starting our closing of fiscal year 20 and solidifying a lot of these numbers and doing year-end accruals and things like that. But so far, so good. So this is good for this fiscal year after having been through a couple of years with deficit budgets. I'm happy to be able to report a positive net position for the year. So here's to that continuing. You can go to the next slide. Revenues, you can see compared to last fiscal year, revenue is up. General fund is roughly the same, if just slightly lower. That has to do with the implementation of the statewide redistribution of general fund. So if you recall, we lost about $500,000 in general fund for 5 years. That happens till we get to the new distribution method. County funds remains consistent as it has for the last 14 or 15 years now. And then all other, much of that has to do, the reduction has to do with grants and the expiration of grants and adjustment of grants from prior fiscal years. Moving on. So expenses, you can see comparatively, administration is down. That has quite a bit to do with the adjustment from how administration was booked in fiscal year 19 versus 20. You can see provider network expenses are up. That is something we expected, not only with the increase in demand, but also in the expense related to the $2 pass-through and the enhanced compensation through COVID. So we did expect that to go up. Grants is down, again, same reason as I mentioned, and it tends to have a bit of timing issues related to just getting the reporting in and things like that. And then all other is basically flat comparatively. Moving on, so net income, again, total revenue is up from the June 30th of 19, so compared to last fiscal year. And then looking at total expenses, we're actually roughly even for total expenses, so you're seeing an offset there. And then net income, you can see that positive 9 million that we have this fiscal year, whereas this time last year we were at a net loss of about 13.7 million. Next slide. So this is the same slide you see every month with the top 15 providers and what we have paid them year to date, and that remains consistent. And the next one just speaks to each of those providers and essentially what we contract with them for. So with that, I will take any questions.
Are there any questions for Anya? Well, you must have done a remarkably thorough job.
Works for me.
Yeah, well, the numbers look pretty good, so it's not such a hard report to listen to or deliver, huh?
Exactly.
This is
Are there any
Hadass. I had a question.
Oh, sure. Hadass?
First of all, thank you so much. That was great, and it's wonderful to see that we've got revenue coming in. I just had a general question in that because the increase in revenue for eligibles is up so much, is there the flexibility at OCHN to increase, marketing our services, and, just increase the budget in that area for now so that more people know about our services? Because I know there's, obviously not everybody does, especially if they're new to the situation, which is why there's more people that are eligible. So that's kind of a general question.
So it is generally the expectation when revenue goes up because of eligibles, at some point we will see some of those eligibles. And so it is definitely a priority to be educating the community about our services. And so remember, unfortunately, we're now a week out from the new fiscal year, so there's not a lot to be
Right.
done with fiscal year 20. But I do believe there's some discussions being had on fiscal year 21 about how to really do what you're saying and really make sure that we're getting information out related to the services provided, the providers we work with. I don't want to put Christine on the spot from a communications perspective, but I believe she did review that just a little bit about her communications plan in her department review. So there is definitely some plans in the works to be educating the community about the services available through our organization and our network.
Great, thank you.
Mm-hmm.
Anyone else have a question or a comment for Anya? Well, it looks like everybody is well informed and satisfied with the information that they have. So if there are no other questions, we'll move on to the next item on the agenda. Thank you, Anya.
Yep, thank you.
The next item is an item for approval, and it is our fiscal year 21 annual plan and budget, and I'll turn it over to the team.
Thanks. Good evening, everybody. Just wanted to say thank you again for all the suggestions and the guidance that you've provided on the FY21 annual plan, budget, and presentation format. I know we've gone over the plan, the budget, and the presentation in its entirety several times now, and you've received the full version copies of all three of those in your packet for this evening. So I'm just going to highlight the areas where we made changes, and Anya and I can answer any questions and then ask for approval on all of the documents. So this is our community education goal, which falls under the advocacy and empowerment strategic area. We added the use of virtual platforms, but since we're here, I'll just also point out, based on Hadassah's question that she just asked, that access to care and making sure that we're advertising how to access services is also part of our FY21 annual plan goal. And then the only other change we made on the next slide is we've added a slide to the presentation format, and that includes reports on fund source and whether or not an objective or initiative was budgeted for FY21. So those were the only suggested changes that we received. I did check our public comment form again around 4:15 this afternoon, and we have not received any additional public comment in relation to our annual plan or budget. So at this time, Anya and I are happy to answer any questions you might have related to any of those documents.
Are there questions, comments? I know we've had several opportunities to look at this information, but there might still be some lingering thoughts. Or not. If not, if there are no additional comments or questions, I think we will then proceed to the vote. I just don't want to overlook anyone. I'm not seeing any hands or anything in the chat. So Nicole, thank you. Appreciate it.
Thanks.
Sheila, I think we'll go with the roll call vote, please.
Excuse me,
Judy?
Did we
Yes.
put
We have to make a motion.
the motion?
Oh, I'm sorry. Yes. Is there a motion
I was
to
going to
approve
make
the
that
annual
motion to
plan and
accept the
budget?
plan and budget.
And I will second that motion that
Okay,
Malachi
so
has just
Kaya
made.
and Jonathan, thank you. Not that I'm trying to hurry things along at all, huh? Okay. Thank you both. Sheila, please call the roll.
Mr. Furman,
Yes.
Dr. Top,
Yes.
Dr. Hans,
Yes,
Mr. Landsman,
Yes.
Ms. Namie Dyer,
Yes.
Mr. Torres,
Yes.
Mr. Lindemeyer,
Yes.
Ms. Bernard,
Yes.
Dr. Guadalupe,
Yes.
Ms. Newman,
Yes.
Ms. Summers.
Yes. Thank you. Our next item is also an item for approval, and it is from Edna regarding PA 152.
Yes, thank you very much. As you will recall, earlier on August 25th, yes, August 25th, I presented the information about the background of the Public Act 152 resolution. Just in summary, the Public Act 152 resolution requires that the public employees in the state of Michigan pay a minimum of 20% of their health care benefits. They can be exempted from that requirement if the board of directors of that particular public body votes to pass a resolution to exempt that requirement. I did present considerable background about this resolution at that study session on the 25th. And as agreed to during that study session, the formal vote would occur at today's meeting. So I wanted to make sure that you, as a board, had good understanding of this requirement and also had a chance to consider our request to opt out of the requirements of Public Act 152. Strictly by way of coincidence, it turns out that our current structure with our benefit plan does result in our employees having a 20% share in the cost of our healthcare benefits. But it's still very important to us as a leadership team that we have that flexibility and autonomy to continue to modify our own healthcare plan as necessary to attract and retain talent in our organization and to effectively manage outcomes for our employees and for the organization. So with that said, I'm prepared to answer any questions that you may have. And at the end of that, I'd like to ask the board to take a vote.
Thank you, Edna. Are there questions? Jonathan?
Thank you. I do understand that every year we have to go through the process of reaffirming this PA 152 of allowing our members.
Can you turn off the TV? Oh, sorry.
Sorry. So I understand we do want to reaffirm this resolution every year, that we can basically allow our employees to, I guess it's not allowed, that they can pay less than 20% if we've so structured the plan. So the question I have is, once we've approved this, when will we be posting the actual plan for the next calendar year?
Well, with our plan document, our plans always start at the beginning of the calendar year. So we have a 1/1 effective date. But for open enrollment, which usually occurs in the fall, we always publish the documents. So if that's something that the board would like to have access to, we can certainly make that available.
Well, I know in years past, and I'm trying to ignore last year in general, but in prior years, we've approved the medical plan as well. So I just wondered, at least I thought we did.
No, my recollection is that the medical plan itself is just part of our regular administrative operations, and we have, provided the board with updates, and I did that back on the August 25th presentation, just a general overview of what our cost structure looks like and how we have been responding, when we have cost increases or any modifications that we've made. So it wasn't a technical approval of the medical plan itself, but information about what the expenditures and what the outcomes have been related to the medical plan structure that we have.
Okay. And I do remember that one. That was for the current year. I just didn't know. And I just know that in past years you've briefed us then.
Oh, I'm sorry. Okay,
Upcoming plans.
I follow what you're saying. We do not plan to make any modifications going into 2021, if that answers your question. We've been satisfied with the results so far, and we've been pretty much on target with what we expected the performance to be. And there's so much uncertainty this year that we'd like to get a better handle on what things will look like going forward as the medical plans adjust to what is happening in the COVID reality.
Okay, but at least at this point, it doesn't look like you're changing plan or plan dynamics or plan structures for next year.
All of the above is correct.
Okay, that was the only question I had on this.
Thank you. I appreciate that.
Are there other questions or comments regarding Public Act 152? Do you understand? Edna, just to confirm, this resolution allows us to opt out of Public Act 152?
That is correct. The legislation does require a formal approval of the resolution. Just by way of reminder, the county also has taken this position.
Thank you for confirming that piece. Are there other questions? Is there a motion to approve the suggestion in the resolution to opt out of Public Act 152?
I make a motion. This is Eric.
Thank you, Eric. Is there a second?
I'll second the motion, Malkaya.
Okay, thank you. Sheila, I'll have you call the roll again, please.
Thank you. Mr. Furman?
Yes.
Dr. Taub?
Yes.
Dr. Hans?
Yes.
Mr. Landsman?
Yes.
Miss Namie Dyer?
Yes.
Mr. Torres?
Yes, Mr. Torres, yes.
Oh, sorry. Mr. Lindemere?
Yes.
Miss Menard?
Yes.
Dr. Guadalupe?
Yes.
Miss Newman?
Yes.
Miss Summers?
Yes.
Thank you.
Thank you, Sheila.
If I could just take a moment to say on behalf of the OCHN leadership team and all of the nearly 200 employees that we have at this time, we express our sincere gratitude to the board for continuing to allow us this flexibility. It's greatly appreciated.
Okay, Steve, did you have something you wanted to say?
Yeah, I do. I found how to raise my hand. It's those three little dots.
Well, it works.
Not to do. This has to do with what Jonathan was saying, and I brought this up a couple of months ago. This medical plan involves an expenditure of over $100,000, and according to our rules and bylaws, the board needs to approve that. So I don't think we need to do anything different this year, but next year when this all comes up, I would think it would be, according to our rules and bylaws, if we haven't changed them by then, that Edna would also present us with a plan like she has every year, but also how much is it going to cost, and then bring that up for board approval. I don't see any reason why we wouldn't approve of it, but I have no idea what this medical plan costs OCHN. So I think it should be brought up to us in the future and approved. That's all I have.
Thank you for your comment. Anyone else before we leave? Steve again?
Oh, I thought I was taking it down. Sorry.
Okay, Jonathan?
And my point about it was that if we are bringing it up as business to approve, that we do it before the open enrollment period starts. So.
Well, we're in a good position right now because, this has been really great being able to do this well ahead of the open enrollment period.
Okay.
Other comments before we move on? Jonathan, did you have something else that you wanted to say? Your hand is still, oh, okay, all good. Any other comments? Thank you, Edna. Appreciate the presentation.
You're welcome.
The next item on our agenda is another item for approval, and that is the fiscal year 21 CMHSP contract. And Anya's going to take the lead on that discussion.
Yep. Okay, so the CMHSP contract for going into fiscal year 21 is essentially what the current contract looks like, just moving timeframes. So the amendments that you have recently approved for the CMHSP contract are all incorporated into this, and so it is for the next fiscal year. I believe it does have the reduction of the 500,000 that I talked about built in to it with our budget. That will be confirmed when we officially get our allocation, but that is my expectation. So this is just a carryover from fiscal year 20, combining all amendments from the base contract in fiscal year 20 to fiscal year 21. I'm sure you have access to it in your packet, all, I don't know, 200 pages of it, should you like to read through it. This one covers fund sources specifically of general fund. Everything else has essentially been removed out of there and moved to a Medicaid fund source, so it's gotten a little less complicated over the last couple of years. So with that, I can take questions and we'll be seeking approval.
Jonathan?
Thank you. I think this is one of the first years that I've been on the board where we actually knew what our budget will be from the state on or before we actually got the contract that we had to approve.
Yes, so you're correct as it relates to Medicaid. This is probably the first year that I can think of since I've been in this position that we have had rates, Medicaid rates this early. So that is very good from my perspective. The CMH one remains relatively consistent, so it doesn't fluctuate as much. I do know that they are continuing with the implementation of the statewide distribution change, so I do expect that to impact our general fund revenue.
Okay, and I know the CMHSP contract is more than just Medicaid. It's the other components as well.
Well,
But
so the CMH one is just the general fund. The PIHP contract is all the other Medicaid fund sources. We actually don't have the PIHP contract yet, which is an interesting dilemma because we will not meet as a group again prior to the start of the fiscal year. But given the state has not sent it to us yet, I would make an assumption there is some leeway on that one being signed before 10/1. So they're going through a process currently of kind of restructuring it to a more standard boilerplate that the entire state uses. So that's required a bit more due diligence in the PIHPs reviewing it and having conversations back and forth.
okay, so normally funds flow from state to PIHP down to CMH.
Yes, if we weren't a standalone, you are correct.
Right. But because we're a standalone, even though that does flow in that direction, if we don't have a PIHP contract, we can still get paid by the state.
I would put money on that we will have it before we actually are due to get paid.
Just
so
the end of September.
Yep.
Yeah.
So that's they've got a little leeway in that we're not actually paid the majority of our money till the last week of the month, and we have a smaller payment that comes the second week of the month, but I suspect we'll have it before then. We'll just have to juggle a little bit what their expectations are around getting it signed. They understand we all meet as boards and the board has to approve it, and that's a set schedule. So I suspect there'll be some flexibility there.
All right, thank you. And I know that we haven't received our last payment of the fiscal year yet.
Correct.
Because even though it's late in the month and it's fall already, it's coming next week. All right, I have no other questions.
Thank you.
Thank you, Jonathan. Are there other questions for Anya regarding the CMHSP contract for fiscal year 21? If not, is there a motion to approve the contract as presented?
I will make that motion.
Thank you, Jonathan.
The CMHSP contract for fiscal year 21.
Great. Is there a second?
Second.
Thank you, Adam. Sheila, roll call again, please.
Mr. Furman.
Yes.
Hello.
Yes.
That was a yes.
Dr. Taub.
Yes.
Dr. Hans.
Yes.
Mr. Landsman.
Yes.
Miss Namie Dyer.
Yes.
Mr. Torres.
Yes.
Mr.
Yes.
Lindemer.
Did you?
Yes.
I heard you, Mr. Torres. Miss Bernard.
Yes.
Miss Newman.
Yes.
Dr. Guadalupe.
Yes.
Miss Summers.
Yes. Thank you, Sheila. Thank you, Anya.
Thank you.
Next item is also an item for approval, and that is the contract with Communication Professionals, Inc. Diana's going to walk us through that.
Hello, good evening, everyone. This is the approval for Communication Professionals, Inc. They are our provider for AV equipment and services, as well as physical building security services and equipment as well. I presented this in the details to you last week. What we are looking for approval is the ability to increase the not to exceed amounts on the two contracts in total of not to exceed $15,000. Are there any questions?
Hi, this is Hadass. Yeah, I had a question. It was my same question as it was last week. We had talked about the possibility in the fourth paragraph, instead of saying the current not to exceed amounts for the contracts, it was supposed to be the 2018 not to exceed contracts.
Oh, I thought I changed that, and clearly I did not, Hadass. Sorry about that. So we had wanted to just say the, I think that would be 2019 or 2020, not to exceed, right?
Well, that was what I had been asking, because their contracts couldn't have been that high though for those years. So we're in the fourth paragraph. It says the bulk of the expense for this contract was related to the initial renovation of the Troy building fiscal year 2018. I mean, I guess you could put 2019. I don't.
Oh,
I don't
I'm
know
sorry.
who
I was on the wrong sentence. Yep. So the bulk of in 2018. Yep. Got it.
I think. I mean, I don't know when the AV. I would think that was when the security, all that.
It would have been 2017, 2018,
yeah,
but in fiscal year 18,
yeah.
you're correct. Yep.
Okay. I just think we need to. It just implies that we spent it this year and we didn't.
Yep.
So if we could fix that, I'm totally supportive. Thank you.
Absolutely. Thanks for the reminder. In my mind, I fixed it, Hadass.
Kind of virtual, huh? Are there any other questions regarding this contract and the approval? If not, is there a motion to approve the Communication Professionals, Inc. contract?
It's Sarah Guadalupe. I'll make the motion to approve the communication professionals contract.
Thank you, Sarah. Is there a second?
I'll second. This is Rena.
Thank you, Rena. I'm going to wear Sheila out. Sheila, would you call the roll, please?
Sure. Mr. Furman.
Yes.
Dr. Taub.
Yes.
Mr. Landsman. Mr. Landsman. Dr. Hans.
Yes.
Miss Namie Dyer.
Yes.
Mr. Torres.
Yes.
Mr. Lindemeyer.
Yes.
Miss Bernard,
Yes.
Dr. Guadalupe,
Yes.
Miss Newman,
Yes.
Miss Summers.
Yes. Do you want to go back to Jonathan, or did he?
Mr. Landsman. I don't know if he's having connection issues.
Looks like he was,
Okay.
yeah, kicked out of it, said he left.
Yeah, I got.
Oh, I
kicked out
see
too,
too.
so-
Yeah. All right.
Okay.
Thank you.
Mm-hmm.
We'll move on. The next item, also for approval, is the CEO evaluation. Sarah's going to lead us in that discussion.
Thank you, Judy. So I am this evening looking to take a vote here shortly on the CEO evaluation that the search committee developed. And so we went over that evaluation tool in detail during the committee of the whole. Sheila's got that document up. So as just a quick reminder, the evaluation we revised to include more data points and more objective information. So there are 10 categories that we will be rating the CEO on, and we have a lot more data points. So we've implemented a 360 evaluation so that we can get input from all of the stakeholders via surveys and other data points as illustrated and indicated in this document. And then in addition to the CEO evaluation document, we have a incentive bonus structure based upon the scores that the CEO received in the evaluation. So that incentive structure is on a different document. I don't know if Sheila has that, but we did go over that last week with how many points would include how much of a incentive off of the base salary. So if there are any questions, I can take questions. Otherwise, looking for a motion to approve the evaluation and the incentive structure. And as a reminder, this component was required as part of the CEO's salary. So we thank Dana. We know we're a couple days late. We had 30 days to do this, but just given the nature of the timing of the meetings, we were a couple days late. So thank you for your flexibility, Dana, and I'll take any questions.
Does anyone have questions for Sarah regarding the document or the structure for paying the bonus?
I kept saying incentive, it's performance, sorry, wrong word, but performance bonus.
I'm not seeing anyone. I know we've had some good discussions on this, so maybe all the questions have been answered.
So thank you everyone that was a part of this team and got this done, and happy to have our new CEO in place and moving forward in a positive direction. So thank you everyone. And yeah, we'd just be looking for a motion to approve.
Would you like to make that motion, Sarah?
If I can, I will, sure thing.
Sure.
I will make the motion to approve.
Is there a second?
It's
that Malkaya?
Second.
Thank you. Just writing here. Sheila, if you would call the roll again, please.
Sure. Dr. Todd?
Yes.
Dr. Hans?
Yes.
Mr. Berman?
Yes.
Mr. Torres?
Yes.
Miss Amy Dyer?
Yes.
Mr. Landsman?
I apologize. I just got my power back. I got knocked out. Is this on the topic of the CEO evaluation?
Correct.
Yes, it is.
Okay, I vote yes. I apologize for missing the prior vote. I just didn't have any access. So I vote yes.
Mr. Lindemeyer?
Yes.
Miss Bernard?
Yes.
Miss Newman?
Yes.
Dr. Guadalupe?
Yes.
Miss Summers?
Yes, thank you. And thank you to Sarah and Steve, Jonathan, and Malkaya for all of your effort. And again, welcome aboard, Dana. It was a long journey, but it was certainly one that is very fruitful. And we look forward to a really productive future.
Thank you. I'm excited to be here.
We're excited to have you. The next item on the agenda is the appointment to the Recipient Rights Advisory Committee.
Right. Thank you, Madam Chair, for allowing us to present this. Regrettably, the Recipient Rights Advisory Committee is recommending that a member of the committee be removed. Mr. Bigelow was an active member. He did come down with a health issue. He has not attended a meeting since February. We knew that he would be off for several months. Unfortunately, we have not had any contact with him since March. We've tried every avenue we could to reach him, to figure out where he is, to see how things are going, to see what his status is. We have not received any communication from him. All that is detailed in the recommendation that was provided to the board. So regrettably, we are asking that you remove him. The committee feels that we should have active members on that committee so that we can do our work. So we are requesting that you approve the removal of this particular member.
Okay, thank you, Vicki. Are there questions for Vicki? Malkaya?
Yes, thank you, Vicki, for bringing this before the board. I know the last time we had a similar situation, it was recommended that someone physically go to the person's house. Has that type of a welfare check been done for this gentleman?
He has no known address. His mailing address is a P.O. box.
Okay. All right. Thank you.
Yeah.
Just wanted to make sure we did everything we could. Thank you.
Thank you.
Sarah?
Yeah, I just want to mention in the correspondence, it does look like you did reach out to family. So it feels like we've done due diligence because you've gone above and beyond trying to reach family as well. So yeah, am I correct in that?
That
Yes.
is correct.
Okay.
And the family member does not have any contact with him either anymore.
Okay. Thank you.
Other questions or comments for Vicki? Is there a motion to accept the recommendation of the Recipient Rights Advisory Committee with regret to, I don't even know how to properly say it, to no longer have Mr. Bigelow be a participant of that committee?
Thank you.
Is there a motion?
This
Sarah?
is Jonathan. This is Jonathan. I'm on the RRAC committee, and we did as a committee vote a unanimous decision on this. So knowing that and knowing how much effort that Vicki and her team put in trying to reach him, regrettably, I will make this motion to remove Chuck from the board. I'm sorry, from the RRAC committee.
Thank you. Is there a second? Sarah?
I will second it. Sure.
Your hand's up. That's why I called on you.
I never put it down from before. Sorry.
All right.
But I'll second it.
Okay, thank you. I think we can do this one on a voice vote. All in favor, please say aye.
Aye. Aye.
Aye.
Are there any opposed? Thank you. And again, with regret, we accept your recommendation. Thank you, Vicki. Okay, the next item on the agenda is the overview of the SUD area. Christina.
Good evening, everyone. Thank you so much for allowing me to present tonight. I would like you to please excuse my voice. I'm getting a case of laryngitis, I believe. And I also am going to turn off my camera as I've been having some connection issues, and that seems to help. So thank you very much. And with that, next slide, please. As you will see, I report to Dr. Lawson, the Chief Operating Officer, and a part of her director's team. Next slide, please. I oversee 3 departments: substance use, access, and the justice team. And this is a depiction of all those in the teams that I support. Next slide, please. Next slide, please. We'll start with substance use. The substance use disorder staff work with the network of providers to deliver numerous services at several levels of care. We also have what is called a screening, brief intervention, and referral to treatment specialist. She's a prevention specialist and master of public health that works at Honor Healthcare to assist people and educate people regarding misuse of substances. That leads all the way up to referral to treatment if necessary. Next slide, please. So as you know, I recently presented the strategic plan, and you had the entire plan sent to you for your reading pleasure. So one of the things that the substance use team does is really support and put forth the strategic plan. These are an example of some of the goals. One being implementation of medication-assisted treatment for people with alcohol use disorders. The next slide, please. So we have several funding sources, some that are newer and some that we've had for many years. For example, the block grant, the Substance Abuse and Prevention and Treatment block grant, is something that has been a fund source for nearly 40 years at this point. It comes through SAMHSA, the Substance Abuse Mental Health Services Administration, and it's comprised of 80% federal funds and 20% state general funds. We also apply for grants, such as the opiate-specific grants for the opiate epidemic. We have individuals that are supported with Medicaid or Healthy Michigan Medicaid. And then we also have the Public Act 2 funds, which are comprised of Oakland County's convention facility and liquor tax funds. The law states, Public Act 2 states, that 50% of the revenues from convention facility and liquor taxes in our county must go to the substance use entity. And it is our most flexible funding source. The only thing that it is not allowed to do is fund specific administrative services at the PIHP. It is really for direct services. Next slide, please. So really the purpose of the team, an overarching purpose, is that it ties into our strategic plan, and we oversee all of the contract management for prevention and treatment services, and we provide technical assistance. Next slide, please. Prevention, our prevention coordinator, who is a prevention specialist as well and a licensed social worker, works very hard to partner with community organizations. She researches new initiatives, manages the 8 prevention providers and 21 coalitions, contract requirements. And most programming is geared towards youth. So our prevention coordinator works very hard to look at new and innovative programming and best practices related to prevention services so we can avoid the onset of a substance use disorder. Next slide, please. In treatment, really the overarching goal is that we ensure substance use treatment is available for individuals in Oakland County and to assist people on their journey to recovery. So that could be from early intervention services all the way to withdrawal management in residential or medication-assisted treatment. We also work to develop new and innovative programming. We work with our community partners. One of the innovative programming that we've created is the Sober Support Unit, or what was termed as social detox in the past. And that is a 24-hour, 7-day-a-week, 365-day service for individuals who would like immediate access to substance use treatment. Next slide, please. So our contract managers are also clinicians, and they research new and best practices. As I mentioned, also our prevention coordinator is a prevention specialist. So they work really hard to identify leading evidence-based practices and emerging best practices so we can provide the best treatment and prevention services for the people that we serve. They work very closely with our funders, meaning Michigan Department of Health and Human Services and grant administrators. They work very closely with community and our providers, and they are assigned tasks according to their area of expertise. Next slide, please. As I mentioned, our contract managers for treatment are also licensed master level clinicians who have a specialty in substance use disorders. And so they work very hard with our providers and offer technical assistance regularly. Sometimes that's very rarely, and in some cases it could be weekly. They also work directly with people we serve to help navigate the system and answer any questions. Next slide, please. So this is just a depiction of the people we serve and how we serve them. Overall, last year we served 4,604 people. Now sometimes that looks higher, and that is because people access numerous levels of care throughout their treatment and recovery journey. And so those are counted at each time they have a level of care. So sometimes it looks as if it's 6,000, but if we're looking at distinct individuals, it's about 4,000 to 5,000 roughly every year. I've seen it over the past 13 years vary, between 4,000 and 5,000. We have our Rye Center, which is Recovery Information Support and Education, that is open to the entire community. It's a public benefit, it provides case management services. You see how many people we serve through that since its inception. And our Sober Support Unit since its inception and the time of writing this presentation was nearly 3,000. I would venture to guess it's at 3,000 at this point or over. And then we have the My Strength app that is open to the entire community as well. And we currently have about 1,300 individuals. We also promote awareness of treatment and prevention services through marketing campaigns and speaking engagements. Next slide, please. So I talked about the technical assistance in reviewing evidence-based practices, and that's really to ensure that we are providing and our providers are delivering quality care, and that if there are any quality improvement issues, we address those immediately and work with our providers to become in compliance. And we certainly are working with them regularly to make sure that they're following contract requirements and in compliance with state and federal rules. Next slide, please. So we sit on many different committees and boards and focus groups throughout the years. This is just simply an example of some of the work groups and committees that we sit on. We're heavily involved in the community as we think it's very important to continually send the message of how people can access services and what we do within Oakland Community Health Network. Next slide, please. We also have presence on many statewide work groups. For example, I chair the statewide substance use directors group on a monthly basis, and you can see some other statewide programming and work groups that we are involved in. It's important to remain involved, so we're at the forefront of new and emerging practices and that we stay involved with our funders. Next slide, please. Do you have any questions on substance use?
Jonathan?
Thank you. Christine, a wonderful presentation. Thank you so much. I'm always amazed at just how many things that you guys have going on. And maybe I missed it during the presentation, but I know every year you have a team of people that seem to go out and identify who sells cigarettes to underage minors and who doesn't. And I didn't know with COVID if one, that was still a survey or an effort that's going to go on this fall. And two, with the increase in the smoking age, has that affected our programs related to that? And I guess the third question is, are they ever going to expand that from cigarettes to e-cigarettes as well? That's it.
Excellent question and excellent memory, Jonathan. Yes, that is called the sign-our amendment. And that actually, the only way we would be able to avoid conducting the compliance checks in the education would be if the amendment was changed. And so that would require a bill submitted. So yes, we were absolutely responsible for providing the education and the compliance checks. They did expand the age to 21, so that made it a bit more complicated. COVID made it quite complicated as well. And it did also expand this year to include ENDS, or electronic nicotine devices. I am so happy to say that despite all of those barriers and difficulties, we are in full compliance. We received 82% compliance. We're generally well into the 90s. You have to achieve at least 80%. And so given all of the roadblocks, I think we did a phenomenal job, and I can truly credit Rachel Rhodes, our prevention coordinator, and the Alliance of Coalitions of Healthy Communities and the coalitions who conducted all of the education and compliance checks throughout the county. So thank you for asking, and it was a great success this year despite COVID and the other roadblocks.
Great, thank you. I appreciate all the work you and your team does on this.
Thank you very much.
Now, Kaya?
Hi, Christina. Thank you for your overview. It was very enlightening. I noticed that you had women's specialty services listed, and I don't remember seeing that. Could you just give us an idea what that would look like, what those are comprised of?
Absolutely. Women's specialty services are a federal mandate that we actually have to meet what's called a maintenance of effort, or actually the state needs to meet it, but they put that maintenance of effort on us. And that means we have to reach a target amount of spending. Oakland has always reached their target amount of spending. We do a great deal of outreach. Women's specialty, you must be designated by the state to be considered a women's specialty provider. And they're monitored differently. There's different reports for it. But most importantly, you have to meet certain criteria. Your program has to have access to prenatal care. It has to have educational resources for children. It has to have daycare for children if needed. It has to have transportation. And we've expanded it to include further case management services and community outreach services. And so I'm very glad you asked me that. We have two providers. Oakland Family Services has been a women's specialty provider and state designated for many, many years, and they do an excellent job. And then we also have Sacred Heart for the residential level. And withdrawal management level, they have what's called Sacred Heart Clearview, and it's a separate residential facility, and it also encompasses all of the necessary services that allow you a program to be deemed a women's specialty provider. They are also excellent, and what is wonderful about the program is moms or caregivers, because they have expanded the definition beyond mothers, because we know grandparents can be the primary caregiver, a father can be a primary caregiver, is they allow parents to bring children with them to treatment. And that, because that's been a barrier in the past. Moms or parents don't want to leave their children. They may not have anyone else for them to be with. So I hope that answered your question.
Thank you, Christina, because I know that's a great need in the community. I didn't know that we had specific providers that provided women's services, so that was very good to know. I'm really glad I asked. Thank you so much.
Thank you.
Eric.
Well, if you don't have the answer to this, I understand it. Maybe you could get back to me. I used to go into treatment centers like Turning Point on Wednesday nights and do a panel discussion about my experience in AA. Can you find out, or do you know, have all of the treatment centers stopped stuff like that because of COVID-19? Or are some doing those panel discussions and others not doing it? Or is that nothing that we would know?
So to get you fully accurate information, I would like to speak to our providers. I know they are still conducting meetings. There are many individuals who are in long-term recovery who have extended their passion and started delivering services and work for organizations. And oftentimes staff will lead meetings because they are also in recovery. But I will find out if they're allowing outside entities to come in. They have had to halt that pretty significantly to allow for social distancing, but I can get back to you on specifics if you'd like.
That'd be great. I'd appreciate it.
No problem.
Jonathan, did you have another comment?
No, I just forgot to lower my hand.
Okay, that's fine. Are there any other questions or comments for Christina regarding her presentation? I have one question. In terms of incorporating peers into what you do, is that done at the provider level? Do we have anybody within our organization that serves as a peer?
So we have peer recovery coaches that sit on our board, our substance use oversight policy board, and we have peer recovery coaches throughout every single level of care at our provider organizations. It is so very important that coaches are available. I've been in this field for 25 years, and they truly have been a game changer in the field and are very helpful. We don't necessarily have a recovery coach that is hired and works for our organization, though. No, we partner very closely with them, though.
Yeah. Okay. Thank you for that information. I know that what you've said about peers within your realm is true throughout the organization. There's no substitute for that lived experience, is there?
No, not at all. Okay, if you would go to the next slide, please, and I'll go through justice services. If there's no other questions, you can go to the next one as well. Essentially, the purpose of our justice team is to assist people with mental health and substance use disorders that are also involved in the justice system. Because people in the justice system, there is no question, are among our most vulnerable, especially those who have mental health and substance use disorders. Next slide, please. And so really, those are our goals. Our goals are to divert people from incarceration and further justice interventions, to work in helping to reduce sentences and recidivism, and to support reentry after incarceration. It's very important that individuals with mental health and substance use disorders are supported as they are released from incarceration, and so they can quickly be connected to the services and supports they need. Next slide, please. Okay, our funds, the justice requirements are actually in our Cmhsp contract, not in our PIHP contract. So those services are not supported by Medicaid funds. And so we apply for a lot of grants. We're supported by general funds, local funds, and we have some individuals doing direct services in the jail, and will be supported by Public Act 2 funds. Next slide, please. And so there are staff assigned to the diversion, to support, and into reentry. Next slide, please. So we always try to promote the least restrictive environments and avoid incarceration, and avoid as much as possible supervision. And we try to do this through education, training, and to teach officers and the system how to divert individuals. We obviously have two excellent ways that officers can divert individuals with mental health and substance use, and that is via Common Ground and our Sober Support Unit. Rather than taking a person to jail, it may be best that they be connected to services right away, and that happens with our officers around Oakland County on a regular basis. We also sponsor and are part of the crisis intervention team training, which really helps officers to understand better mental health and substance use disorders and how to assist people who have mental health and substance use disorders. And then we also have individuals that work in the juvenile justice system. And so to help the family courts and caseworkers assist people in working on diversion and least restrictive environments as well. Next slide, please. When justice involvement is unavoidable, we assist to help navigate the process and ensure smooth access to services. We have staff embedded in the jail. We participate in treatment courts. We participate in juvenile justice screenings. It's just very important that we're involved so we can help both people served and those that work in the various areas really allow for the best services to be provided for the people that we serve. Next slide, please. It's so very important that people remain connected to care. Equally important, whether being released from jail or on parole or probation. So we would like to assist the parole and probation agents navigate the system, understand the system, and again, really help people served understand the system and ensure that they're complying with what the court is ordering. Next slide, please. We like to increase support to really help people achieve their goals and dreams. We want to reduce that recidivism and again, gain better access to treatment. Next slide. We really like to help bridge relationships between providers and parole and probation agents. And that way, the more that they communicate, the better everyone can work towards helping an individual achieve their goals and dreams. It allows for better engagement after a person's been incarcerated, and our liaisons are there to help. They're there to help our providers, the agents, and most importantly, people served. Next slide, please. We are also involved in numerous work groups and committees throughout Oakland County. Those are just an example of some of them that are on the local level. If you could do the next slide, please. And here's some examples of statewide groups and committees that we are involved in at the state level. Next slide, please. If you have any questions, I'm very happy to entertain them at this point.
Malkaya?
Thank you again, Christina.
You're welcome.
Very comprehensive report on the justice system. Just have one quick question about judges, more along the lines of the diversionary type programs. Mm-hmm. And I know that there used to be a lot of resistance from some of the judges to diversion and medication-assisted treatment. Has that changed at all? Are you starting to see any more wider acceptance of treatment from judges?
I am very happy to report that the answer is yes. I think the education from the federal government, from the state government, from PIHPs, really educating judges has made a really positive impact. Of course, there are some judges that may not ever change their minds, but we really assist with that. If a person's doing really well and struggling, we've sent letters on their behalf to try to educate judges. We meet with judges, but really the treatment courts that we're involved in all are very accepting of medication-assisted treatment and work very closely with us on that.
Thank you.
You're welcome.
I have a brief question. This is John Paul Torres. Can you hear me?
Yes, I can. Thank you.
Oh, okay. Great stuff. And I work in the treatment court profession. And so I just kind of wanted to piggyback on what Malkaya was talking about, what you were telling Malkaya, that yeah, we have seen a huge increase in the amount of judges, courts, and allocations of funds for specialty type court programs, and there is so much more of an embracing of treatment and diversion because the cost of getting somebody treatment is actually cheaper than it is to put somebody in prison or jail. And additionally, it keeps communities more safer because the judge community has changed significantly. And there's actually an association now, the Michigan Association of Treatment Court Professionals, which I'm a member of. And we meet annually, quarterly, and we talk about innovations of just like many of the things you just spoke about tonight. So I'm really excited about the movement in that arena for over the past 10 years now. Thank you.
You're welcome. It is very exciting. I was appointed, I think I'm in my second term now, to the State Drug Treatment Court Advisory Committee, and I've seen a real shift. We meet quarterly, and it's mostly judges and prosecutors and law enforcement, and then myself from the treatment community, and I've really seen a large shift there as well. So we're very excited about that. Thank you, John and Paul. Okay, next slide, please. I'm just trying to move forward in the interest of time. So if I'm speaking too fast, please let me know. Okay. Access is arguably one of the most important services OCHN provides, as we are the first faces or voices that a person hears. We also have our Veterans Navigator services, and we decided to move the Veterans Navigator under Access so he can be available right at the beginning of a person seeking services and really catch veterans and meet their needs immediately. Next slide, please. Our manager and supervisor and myself many times regularly provide presentations in the community so they can promote access, educate on how to access, and also educate the community on our services. We also, which is a strategic plan goal. Also, our NCQA accreditation of answering calls within 30 seconds is another part of our strategic plan goal, and also following all of the many state regulations as it relates to that. And then our Veterans Navigator implements strategic goals that revolve around serving veterans and their families. Next slide, please. So we are funded by all of the funding sources that OCHN receives, and Anya will correct me if I'm wrong, but generally what we do is we fund based on the services, the amount of services that people receive and how they're funded. So about 90% of people roughly receive some form of Medicaid, whether it's Healthy Michigan or Medicaid. So you'll see our largest amount of funding is through that, but then we're also funded through general fund, through the Substance Use Prevention and Treatment Block Grant Fund, and some of our local funds as well. Next slide, please. Really the role of Access is to provide eligibility determinations, screen and connect people to services, and also connect people to Veterans Navigator services. Their primary roles are to ensure people receive what they need. Next slide, please. So eligibility determination really starts with our referral specialists. They're the individuals who answer the phone. They do a tremendous job, and they're there to help people with their immediate needs and get them connected to a screening or referrals in the community if they maybe have private insurance or they're looking for sliding fee scales. We have requests for assistance on many levels, whether it's how do I receive food benefits, and they connect individuals to what they need. They also ask the beginning questions and set people up for screenings. Next slide, please. And then our screenings occur by licensed master's level clinicians. And so their area of expertise are mental health, substance use disorders, and intellectual and developmental disabilities. And so they really are there and understand and are trained in the tools to determine the best level of care for an individual, and also based, most importantly, on whether they meet medical necessity, but also on a person's desires and what they're looking for. Next slide, please. The Veterans Navigator really assists staff, providers, those of us at OCHN to understand the very complicated system that the Veterans Affairs system is. Oftentimes we receive a lot of requests for assistance. People don't understand the benefits that they have, and our Veterans Navigator is so well versed in that, he really helps a person navigate it. He helps providers navigate it and answer questions, and like I said, he helps us. And he really goes where people need him, whether it's community events, speaking engagements, meeting with a person face-to-face, or answering phone calls. Obviously, that's been scaled down a bit with COVID-19, but he has continued to provide services, and he has done some forward-facing services still when needed. Next slide, please. Really, the most important thing that the navigator does is work directly with veterans and their families. He works with veterans on a daily basis. It's open to the entire community. You do not have to be eligible for services for him to assist you, and which is why he's right there working in our access center. So when people receive calls, they can be connected immediately. Next slide, please. Access impacts and veteran services impacts really everyone, our organization, our providers, and the people we serve, because it really aligns people to services within their organizations and meeting with the Veterans Navigator. Next slide, please. We also sit on many work groups and committees throughout the county. Again, that is to provide our subject matter expertise and also ensure people understand how to refer people to services and to access services. The same goes for our Veterans Navigator as well. And then next slide, please. We're on a bit less statewide committees and work groups. However, access is talked, like we talk about access all the time, for example, in our substance use director work group. It is talked about because it's so a part of everything that the PIHP and CMHSP system does as it aligns people to services. So it's really kind of embedded everywhere, but those are kind of examples of some of the work groups it's been discussed. Next slide, please. And with that, that concludes my access portion of presentation, my last presentation for the night. And so I'd be happy to entertain any questions with that.
Okay, thank you, Christina. Are there questions, comments?
This is Hadass. I have a question.
Sure.
First of all, I want to just thank you so much for this really fabulous presentation. And it was my question actually doesn't have to do with access, although I will say that that is extremely helpful to the community. I actually had a question on the re-entry transition portion when you were talking about justice. So I don't know if you want to go back to the slide or I can just.
No, that's okay. I can talk to it. So are you asking, do you have a specific question or do you want me to talk more about it?
No, I have a specific question. So
okay.
For the re-entry transition at the bottom, it talks about who performs this function. It says OCHN staff at OCJ. So do we have a full-time person there or a part-time person there?
Oh, we have 2 full-time individuals in the jail. We support staffing staff in the jail as well. Our organization funds and supports staff in the jail as well, so that work directly for the jail. But we have 2 OCHN.
I'm talking specifically about. I'm sorry to talk over you. I'm talking specifically about the re-entry transition. Do we have 2 people working just on the transition?
So no, we have 1 specific person that works on re-entry, and then we have an individual that works specifically with people with substance use disorders when people are transitioning and they're in the MDOC system. And so if it wasn't COVID, they'd be going into prisons, et cetera, to meet with individuals if needed, but they really help people on parole and probation. We have Melissa Gregorio, who it really works specifically on reentry for people with mental health disorders, and actually in fiscal year 21 will start to work more fully with individuals that have substance use disorders. One of the staff we support in the jail also coordinates all the care with our staff for individuals that are in our jail medication assisted treatment program and ensures a smooth transition into the community. We also support a recovery coach that goes into the jail on a regular basis to support individuals in that program as well.
So when they talk to like parole officers, like how often do they talk to the parole officers about what, the transition of where these people can go? Like, is there like are there trainings that go on like monthly? I mean, because I think a parole officer makes a huge difference.
It's funny you mentioned that. We just concluded a recent training with parole and probation agents. We actually have 2 staff that work outside of the jail that primarily work to assist individuals with mental health and substance use disorders as they're involved in parole or probation. And so we have a liaison that's a liaison between an individual served, the provider agency, and the parole or probation agent, both for people with mental illness and for individuals with substance use disorders. When we took over the services or funding the services for people under the supervision of MDOC, the state also designated individuals as a priority population. So they are screened within 24 hours of request. And then we have an MDOC liaison that works directly with individuals and the agents from the moment of request for services. Now in the jail, all of that's connected there. We also have a staff, an access staff, that works in community corrections, which is really talking about your pretrial services and working with probation agents as well. And she does that actually by being embedded in community corrections and works to explain what services and supports are offered in hopes that that will be taken into consideration when they make recommendations to the judge.
Yeah. So I'm just wondering, I know I'm being really specific, like how often, or is it just like a casual thing?
No, daily basis. Daily basis.
So that all, and so just because they need reminders is my guess, on the options that are available.
Oh, daily. Both liaisons with the parole and probation agents literally work with them on a daily basis. And we provide regular trainings. And then Melissa, who's our liaison in the jail that works on reentry, is working with individuals all throughout and then follows them after they've been released from incarceration to ensure they have housing, to ensure that they've been connected to services if they need anything else. So really, it's very close coordination and contact.
That's a lot for one person to do.
Well, we have, it's one person in the jail. And actually, she does a very, very good job. And she has our other person in the jail that works more directly in the treatment side of things. Also, they assist each other as backup. And then we assist, or our other liaisons assist if there's further services needed. But remember, once they leave the jail, then we have our other liaisons that are able to further assist once they're through that process. So it's actually more than just one person.
Yeah. Okay. And so the other thing I wanted to comment on was John Paul, and you spoke about and Micaiah asked about the judges being more aware of the options than other options aside from incarceration. Does OCHN track that? Do we have data over the last, like you said, it's gotten better. Is it the last 2 years? Is it the last 5 years? Like, is there data showing the changes that have been taking place anywhere, number-wise?
I would have to look if there's specific data, but one thing I can tell you for sure is that allowing a comprehensive medication-assisted treatment program to be opened in the jail is a very good indicator of that. And then we sit on the various treatment courts. We have numerous staff that sit on the various treatment courts through Access and the Justice team, and they're all accepting of the medication-assisted treatment. So on an anecdotal level, we've just seen far more people involved in the justice system. But what I could do is run numbers for you of how many people are involved in medication-assisted treatment and involved in the justice system. That I can definitely pull for you.
Yeah, no, I was, so that's been going on for at least a year, I know. How long has that been going on, the medication? I know that's been going on for a while.
Since 2017.
And have they done studies on if it improves? I know some people who've had, I don't mean to go off on this, gone to jail, and yet they might have had some, they go through withdrawal and everything, but then when they leave jail, they don't have, as many problems because they've gone through the withdrawal. But with medication, it's obviously easier on them. But
So, right. Exactly that. Actually, a person is at their most high risk if they've gone through withdrawal in the jail and are released. They're at high risk of overdose, which is why we really approached and worked with our jail to be able to provide services in there, and why we have a peer recovery coach that follows the person until their next appointment. We also work to have their next appointment literally be same day or next day after they've been released, because that is so important. It decreases a person's risk of overdose if they receive their medication, as you said. So it really has helped. And I guess the best way I can show you that is we just recently reviewed the data again. And it started when we would give referrals to treatment only in the jail. There was about a 5% follow through rate. We are nearing a 70% follow through rate, which is higher than statewide averages. Now that the jail MAT program has been working in its entirety. So we've seen continued steady improvement as time has gone on, that people are following through with care and staying in care.
Okay, well, thank you so much for answering my questions and for your presentation.
You're welcome. Any other questions?
I'm not seeing anyone with the hand up, or if you have something to ask, this is the good time. It's so encouraging to see how deeply we reach into the community in this area. It's such an area of concern. So this presentation was extremely helpful to me. So thank you so much for doing such a thorough job, not only in presenting it, but in reaching out into our community.
You're very welcome. It's certainly something we all love to do and are happy to be a part of OCHN. So thank you for allowing me.
We can sense your passion for it. So thank you for that.
Thank you, Judy. Thank you, everyone.
Okay, the next item. Oh, did I miss somebody?
I was just returning the thank you.
Oh, okay. Somehow or another, I overlooked your politeness. I'm sorry. Okay, the next item quickly is there's still time. We've set a soft deadline for the end of September to participate with our donations for the CMH PAC. If you haven't done it yet and you're thinking about it, this slide provides all the information that you need to go forward. And the other item I'd like to remind you about is that we do have a study session on Thursday. I'm sorry, Bijaya, do you have a question on the PAC?
Yes.
Okay.
Judy, I had handed a check on March 9th at the committee of the whole meeting. And I just found out today that that check has not been cashed. So I have mailed one today again. This is a suggestion. Most of us pay our bills online. We don't write that many checks because I find that it's not safe. This is just a suggestion. If there is a possibility of, sending contribution online, that would be preferable. And this is something that maybe we can think about.
Okay, we'll check into that and make that known. We have, my next item was going to be that we have a study session on Thursday. We can provide an update then if that works. Do you think that would be okay, or?
Thank you.
Okay, sure. Thank you. So that provided me with the segue into reminding you all our schedule for on the calendar. It's a little bit skewed because of Labor Day and having to make adjustments, but we do have a study session on Thursday from 5 until 8, and it's going to be covering a variety of trainings for us as board members. There's an updated agenda on Boardable, and you can take a look. I don't want to go into all the details at this point in time, but it's going to be a very important evening, and I hope that everybody has it on their calendar and will be able to attend. From there, I think we'll move on then to the committee reports. Jonathan, Rights Advisory.
Thank you. Let's see. The Recipient Rights Advisory Committee met virtually on August 8th at 4 p.m. Richard Zymark was the RAC chair and facilitator. Mark and Betty delivered a presentation on voting. This presentation was for anyone who was interested in voting, whether they had a disability or not. It was an update over a prior webinar that they created called Voting 101 and Voting Advocacy. Both this one and the other webinars are located on the OCHN website. So the point of this training or this briefing was that your vote counts. Whether you vote at the polls or via an absentee ballot, it counts. There are several laws regarding, including the ADA, to facilitate your right and ability to vote, and these laws date back to 1965. The presenters also covered when to vote, how to complete a ballot, how to complete an absentee ballot, and as well, because there's some crossover or some differences between the three counties, Macomb, Oakland, and Wayne, the different voting machines used by our three counties. Lastly, they covered various voting resources as well. So following that presentation, and Betty is one of the members of our RRAC, longstanding member of it. Anyhow, following that, Gene Fender, who is our manager of recipient rights, reported that we'd had recipient rights training with Dana Bridge. And Gene also provided some updates on 2 system initiatives that were underway. One was really wrapping up, and it was to use SharePoint to streamline and submit the review of all reports. And it's been going on for just over a year now, but it is finally wrapping up to make it a little bit easier to submit, review and submit reports that have to go up to the state. So another one was streamlining background checks. So this is employment verification. And the idea was to use smart sheets. So it's a Google kind of document, I guess. So this project was beginning at the beginning of this month. Basically, when employers hire staff, we do the background check. Yep, OCHN does the background check. It's a challenging process, but it has to be done, and we do it because we're looking to make sure that it's consistent in how it's delivered by all of our core providers and their direct providers. So, and it's a challenging process because we have to get it done before they're hired, and because they're not hired yet, they have to complete and sign a release that allows the background check. Now, once they're an employee, if a background check has to be performed, those do not require a release because as an employee of social services, if you will, under law, that's a service that is allowed to be performed. That is background checks. So, as you guys probably know, RRAC always establishes goals every year as part of our December year-end reporting with the state. One of the goals is to bring more awareness to the mental illness population about reporting potential recipient rights incidents. So what we did this summer, actually in August, was perform training using peers at 3 different sites, at TTI, at Easter Seals, and at CNS. So it was pretty good. I did not attend it, but I did hear from others that it was done very well. Again, this was peer driven, peer delivered. Marilyn Minnick, who's our lead recipient rights specialist, presented a topic on ORR jurisdictional boundaries. So the Office of Recipient Rights, while they can investigate a lot of things, they are limited to, based on our jurisdiction, what they can look at and how they can look at it. So Marilyn's been part of OCHN for 8 years. I think she's been our lead in that space for about a year now. But basically, she summed it up as the powers come from the state mental health code. And it has to meet 3 criteria. The allegation has to be against a provider or individuals related to the health code, and it must involve the following 3 things: a member receiving services, a provider receiving funding by OCHN, and third, the services have to be covered by the MI code, mental illness code. So if it's reported to us, we're going to look into it, but we won't do a formal investigation if it doesn't meet all 3 of those things. Someone receiving services by an organization funded by us, and it's dealing with specifically services covered by the mental illness code. So if it's outside of that area, it is outside of our jurisdiction. For instance, we might hear about an allegation, but we won't formally investigate one that might be related to a guardian, because we don't pay for guardians, even though It might be of a person receiving our services, but it's also not covered by the mental illness code. So those things would be referred over probably to the courts and let them take a long, hard look at the guardian that's doing or been reported of or allegated of doing something that was a misdeed. So very interesting in that topic. Gene Fender, the manager of recipient rights, discussed member absences. So we talked about one earlier in our meeting today, but we really have 5 in all. We have Chuck, who we just did vote out after being absent for 6 months. Other vacancies that we have on the board, Nicole Gittleman, who passed away last month, about a month and a half ago now. So we have to fill her spot on the committee. She was a past facilitator. And then 2 other members, Betty, who I mentioned earlier, having presented to our group and presents to others. She and Sylvia, their terms expire in October, and they can't be renewed because this is a second back-to-back, or this was the back-to-back term that they were in. And then last, we have another person who had recently joined our board, Remy, and I'm sorry, our committee at Remy, and she has just recently relocated to Texas. And our RAC rules require that members must reside within the county. So the other topic that was coming up was site reviews. And as you know, we do site reviews on 400 plus sites every year. Every month we have so many of them that we have to do. They're scheduled. And as of September 2nd, we had hit 84% of the sites. And it was expected that by the end of the fiscal year, so by the end of next week, the site reviews will have happened to all of the sites, all 431. And then we'll start again come October 1st, doing site reviews again for all the same sites. The number varies depending on who's a provider and who's not. So the last 2 items on here that I want to report is MDHHS had their rights conference. It's a virtual conference. It was the second week of September, so 9/14 to 9/17. At the time of our meeting, it was coming up, but now that we've gone past that, it was last week. So registrations happened. We had people that attended. I don't know who attended because I was not one of the attendees, and that would probably be covered in our October meeting. The next one is that OCHN itself has a Go Rights virtual conference that's scheduled for Friday, October 2nd. So that's next week, Friday. It's from 10 to 12. And if you want to, you can register to attend that virtually by going to the oaklandchn.org, selecting news events, and then selecting and registering for the Go Rights virtual conference. And the last item I just wanted to say is our next meeting of the Recipient Rights Advisory Committee will be held virtually again on Thursday, October 1st at 4 p.m. So Vicki mentioned it earlier. So we have 5 absences at this point. I know that in our upcoming meeting next week, we'll probably be interviewing with a few people. But if you know anyone who's interested in actively being involved on the Recipient Rights Advisory Committee, I would ask that you forward their names on to Vicki or to Jean, and we can make sure that they can complete an application and get interviewed, and perhaps the Recipient Rights Advisory Committee will recommend them to fill one of these spots, and then our board itself would be voting to confirm that recommendation. All right, thank you. That's my report.
Thank you, Jonathan. Are there any questions for Jonathan regarding his report? A lot of activity in your meeting.
It's, this is a very active group. So
it is. It's a very vital group. You're right.
It's vital too, but they are very active.
Yeah. Okay.
So,
thank you.
Thank you.
Malkaya, the Citizens Advisory Committee.
Yes. I'm giving my August report, and I forgot that we had our meeting our September meeting prior to this meeting. but I didn't have my September report, but I will give a brief report on August. The meeting was called to order by the CAC president, Lois Schulman, and we had two CAC members that received recognition at the Your Voice, Your Values Award. Nancy Carter received the Director's Award, and Lloyd Austin received the My Life Award, and they're both very active on the CAC. We celebrated them, but we also, as Jonathan mentioned, Nicole Gittleman was also on our CAC, and she passed away, which was a blow to many of us that knew her and loved her. She was a very special person, and she is going to be missed. Ms. Summers came to the meeting along with our new executive director, Dana Lassenby. She introduced herself to the CAC and fielded questions and concerns by the members. She was well received in my estimation. She was very attentive to the needs of the CAC, and she promised that she would be back on a regular basis to interact with our group. I also spoke about the Person Served Committee through the association. Pam Casper, who is also a member of the CAC and a legislative liaison, was on the last meeting with me. In fact, it was just me and Pam and Bob Sheehan. And Bob took the time to be very, very thorough to discuss some legislation that was pending and upcoming with Pam and myself. And I felt like we needed more participation. So I did mention it to the CAC. We had 3 other members who volunteered to join, and they forwarded their information to me, and their information was passed on to Bob Sheehan. And they are also representing or taking part in that committee. Mike, who has been championing transportation for quite some time. I came to the board in 2007, and he was actively working on it then. So he talked about the assessment report that was done, and just some of the issues that are going on with SMART in the area. They had a couple of public hearings because 2 of the routes that were going to directly impact 2 of our core agencies, Easter Seals in Pontiac and CNS Healthcare in Waterford, the routes that people take the bus to get to those 2 locations were being eliminated. So they wanted to make sure people knew that and had a chance to weigh in with SMART over those changes. The committee members that had reports gave their reports, and that is about it for me for August. And I'll entertain any questions if there are any.
Thank you, Melchiah. Obviously a busy meeting as well. Lots going on. That's good. That's really good to know that everybody is taking a progressively more active role outside of the organization. That's encouraging. Are there any questions or comments for Melchiah regarding her report on the Citizens Advisory Committee? I'm not seeing anything at the moment. Thank you. Eric, has your oversight committee met since your last report, or maybe you could tell us when the next meeting might be?
Yeah, you're right. We have not met since the last report. The next meeting is October 28th.
Okay, so we'll look forward to your report in November then.
Fantastic.
Awesome. Thank you. Now we are moving on to our director's report. Dana?
Good evening, everybody. For my director's report for September 2020, I am transitioning into this new role as Executive Director and CEO of Oakland Community Health Network. This has been a fascinating journey thus far, and I'm very inspired by the things that I see. I say fascinating because the level of involvement and engagement of persons served, our provider network, and the community partners, as well as the staff, is inspiring. It really is inspiring because the foundation from which OCHN was built promotes growth and future progress. So, like I said, I believe many times during the interview process and just during the last meetings that I've had with numerous people, I love the fact that we are actually living our mission and our vision. So as I told everyone beginning, when I first started, my commitment for the first 30 days in this role was to really be an attentive listener. So I listened very closely. I learned a whole lot, and I asked a lot of questions. The answers I received were comprehensive and provided with a broad understanding of how we operate, the high quality of programs and services. So as I move forward in this position as a leader, I will continue to be present and remain accessible to those around me, especially the people we serve and support and their families. What I'm really interested in and focused on now is just really building on the success. And we can't really do that until we really pay attention to some of the challenges we have right now, and we all are being impacted by COVID-19. So as I look at that, I want to make sure people are accessing the public mental health or behavioral health system, and they know we're available and how to access those services. But I know that throughout the pandemic, even initially, there was a significant decrease in the number of people who were seeking services, and that includes behavioral health, crisis, substance use services, and everything is pretty consistent across the county as it relates to behavioral health care. So in the last week, I actually visited the Resource and Crisis Center, which is OCN, where OCHN's access team is located, as well as Common Ground Crisis Services. I looked at the data and the number of calls for non-emergency supports, as well as the individuals who actually visit the crisis center. So if you look at January, and I know you don't have the numbers in front of you, I apologize for that, but they are in your packet of information. But from January, we had 148 people who actually sought in-person services at our Resource and Crisis Center. But during the height of the pandemic, April through May, there were 0 people who actually sought out crisis services face-to-face. We also saw a significant drop in the number of calls to access service. They went from 2,795 calls to 1,525 calls in April. So I know we talked about this in our annual plan. Anya and Nicole really explained in detail what our annual plan was, and the attention was brought to community education. So one of the things I'm really working on and striving to improve is access and information about how to access our services. And I know we understand the impact of the pandemic and how that has decreased the access and outreach that we can do. But I know that we also put things in place very quickly to make sure that people knew how to continue to receive those services through telehealth, through direct and electronic mail campaigns. We really did a great job outreaching to people, as well as looking at our cable television advertisements. And so what I hope to display to you next time that we meet is how that has impacted people's requests for services. So we still have walk-in appointments that are still pretty low because of COVID, but we also want to make sure that the standards are followed for telehealth services, and our providers are doing a great job with providing those services. And they also are told how to access services that are close to them that they can do safely. I wanted to share this information so I can be transparent about some of the challenges with access to services during the pandemic. But as I move forward, I also want to demonstrate to people that we serve, the provider network, that we are attentive and we're looking at ways to make sure that we connect with people and that the delegated responsibilities that we share with our provider network are being fulfilled. So as you see other reports from me, you'll see how it ties to where we are in terms of our baseline and the progress that we're making. So I did want to offer somewhat of some data that I'm looking at ongoing that really looks at how we're applying our mission and our vision and our values. If there are specific topics that you would like me to include in my monthly report, I will do that as well. And I encourage people to reach out to me on my email address, and we'll make that available to everyone, and I'm sure it is. But again, I wanted to make sure that my future reports really do tie to the goals and objectives of the organization, as well as the goals and objectives that have been set forth this evening from this board. So again, thank you very much for this opportunity to report to you. I am meeting a lot of great people and learning a lot of great things about this organization, and I'm really proud of the work that my team is doing. So thank you again, and with that, if there are any questions that anyone has, I'm happy to answer those questions.
Are there any questions for Dana or comments? Malkaya.
Hi, Dana. I have just one. I believe that when we were onboarding you, you had mentioned that you were going to start having meetings with the individual board members. Is that something that you still plan to do?
Absolutely. Absolutely. I know that I've been meeting with internal departments, as well as attending some of the committee meetings and work groups, and then also working with the core providers. But that is definitely something that I want to do in terms of meeting with board members and making myself available. I know that we have some elections coming up with the board members, but that shouldn't stop us from getting to know each other. So I'll definitely talk with Victoria about how we can set up some of those one-on-one conversations.
Okay, thank you.
You're welcome. I would love to come out in person, actually, but we know that's a challenge right now.
Yeah. You know what I always say, I miss meeting in person a lot.
So do I.
Oh my gosh. Are there other questions or comments for Dana regarding her report? A lot of good information. Thank you for sharing what you did. And I was wondering, are you planning on doing maybe weekly updates for the board or bi-weekly? Do you have a strategy for that?
What I would like to continue doing is, this is something that was already in practice, is to give the weekly updates. And so I've been working with the team to get those updates and that information, so that when there's not a board meeting that week, you would definitely get that weekly update every Friday. So
okay,
that you
thank
can
you.
Get the information about what's going on, and anything that's popping up, I want to make sure that I inform this board of that as well.
That sounds like a good plan to me. Thank you. Other questions or comments for Dana? I am not seeing anyone at this time. They know where to find you if something should come up.
Yeah, open door policy for sure.
That's encouraging. Thanks so much.
Thank you.
We'll move on to public comment. Do we have any public comment this evening?
We do not, Judy.
Okay, thank you, Christine. Then we'll move on to board member comment. Sheila, if you would go through the roll, please.
Sure. Mr. Furman.
I'd like to just say thank you very much to the various staff members who put together their presentations tonight. Anya and certainly Christina. I'd also like to say it was great hearing about the story that inspires hope once again, and just really gratifying to see all the resolutions that got approved tonight. Thanks a lot. Everyone be safe.
Dr. Taub.
Hi, it was a great meeting, great presentations, and I've been around a long time. I thought I pretty much knew everything, but every time Christina Nicholas speaks, I learn a whole bunch of new stuff. I'm amazing that one person can have that much knowledge. Secondly, I'd just like to mention that earlier Jonathan mentioned that it was fall, and I wanted to caution everyone, when you use the term the fall, you should really be clear whether you're referring to autumn or the fall of civilization. That's all.
Dr. Hans. Dr. Hans, if you're on, you're on mute.
Yeah, I'm sorry about that. Just follow up on Steve's comment. Right now, it seems like a free fall, but anyway, we'll make it. We'll get through it. I wanted to thank everybody again for great presentations, especially Christina. Yeah, there is always so much to learn about what she uh, uh, supervises and leads the teams on. And I want everyone to be safe, and please register to vote if you have not already. And have a nice evening.
Thank you, Mr. Landsman.
Thank you. I'd like to thank everyone who presented tonight. Some amazing things from an amazing story of persistence. And I don't know if alcoholism, if you truly recover or if you just, it's a constant battle to stay, to keep that challenge from consuming you. So I'm always amazed with folks that are chasing whatever that personal challenge is that they have. Whether it's brought on by themselves or brought on just from being born, and they're dealing with it for a life. So I'm always thankful for that. I think that our senior leadership team did an awesome job tonight in terms of presenting, preparing for the annual budget, the financials, as well as giving us yet that forgotten, what I consider the forgotten side of our MIDD and substance use world, because we don't often think about the substance use. We don't often think about the kids with severe emotional disturbance either. But you know, we definitely keep our eye on MI and DD, and I think that I'm glad to hear that Christine is still there doing her thing, getting people engaged actively. So thank you. And then now one comment about fall, because everyone else is doing it. When you're older, you think you had a fall. When you're young, you just fall. So I would just say that let's stay young at heart, and if you do take a tumble, don't say you had a fall, say I fell. And that's it.
Thank you. Miss Namie Dyer.
Yes, just to reiterate what everyone else has said so far, thank you to all of the presenters today. It's always really good to learn more information, and it's just really amazing and fascinating to see how much OCHN does across the board. So Christina, especially, thank you for that presentation. And felt like we made a lot of progress today. So well done, everybody, with all the different motions that we did have and passed. And everybody just please continue to stay safe. And hopefully at some point we will all see each other in person again.
Thank you. Mr. Torres. Mr. Torres, if you're there, you're on mute. Mr. Lindemere?
Oh, can you hear me? I'm sorry.
Yep, we can hear you now.
Okay, I had no report. I'm sorry. I was trying to unmute myself. Sorry.
Thank you. Mr. Lindemeyer?
I just wanted to respond to, I think, it's Jonathan's question just about the daily struggle of it's a daily struggle every day. In my program, I wake up and thank God that I didn't drink the day before, and work my program so that I don't drink today. The urge to drink is gone, and the urge to do drugs will go away. But if you're not maintaining your spiritual nature and adhering to the program, you're gonna go back into relapse. And the program's more than just stopping the drugs and the alcohol. It's also about living living a life a certain way. And so that's something that we always work on, and we try to be better today than we were yesterday. So I hope that helps you understand it a little bit better than you did before. Thank you.
Miss Bernard?
Hi, I had to unmute myself. So I want to thank the staff and also the board members, and particularly Sunny Monday, who gave that really, really emotional story that definitely inspired hope. And thank you, Eric, for sharing with us. And we're being educated by you. And I just hope everybody stays healthy. So thank you and have a good night.
Thank you. Dr. Guadalupe?
Yep, I just want to share with everyone else's sentiments. Great meeting tonight, and I appreciated everyone's time and efforts into their presentations and stories. So thank you. Have a good rest of the week.
Miss Newman?
Thank you to the staff, to Dana and her staff, and I want to thank the board also. This has been a difficult year for all of us. We're having to make adjustments and do things in different ways, and it hasn't been easy. But I just marvel at how we're still able to make sure that the work is done, that people's needs are met, that we can do the work that we were appointed to do by the county commissioners. And in some ways, it's almost miraculous that in the midst of everything that's going on, we still have a level of normalcy, so to speak. It'll never really be normal again after this. But we're still able to do what we need to do. And I just thank God that that I'm healthy, my family's healthy, the board, we're all intact as far as I know. I haven't heard anything concerning anybody's family with the COVID. And we're already in the fall, and winter's, knocking at the door. It's like, wow, the year is almost gone, but we're surviving this, and not just surviving, but being innovative and being creative and being nimble. And I think we need that now more than ever. So I just would like to heartfully thank the board as well as the staff, and even the core agencies. They've been rolling right along too. It's been a very, very difficult time, but there are so many bright spots, like the story of hope we heard today. People need us, and we're making ourselves available and changing lives in the process. And I'm just thankful to be part of this process. So thank you all. Be well, be safe, and have a good night.
Miss Summers?
Thank you. I guess we were all quite impacted by Sarah's story and her resilience and her persistence. And if that doesn't inspire hope, it's hard to picture what the actual situation would be that would be more inspirational. I certainly do appreciate the effort of our leadership team, Dana, for the quality of the presentations and the level of information that you bring to us so that we can impact our decisions in a positive way and do it from a point of information and knowledge. And we know how that trickles down, so we can't overestimate how important that delivery of that information really is. And I appreciate my board members tonight for being patient. We had a lot of work to do. a lot of ground to cover, and you stayed with it. And I think it was a meeting where our time was well spent. I do want to remind you that we do have the study session on Thursday at 5 o'clock, and it's an important one. It's really, I think, an opportunity to get a broader perspective in a variety of areas and double check on Boardable for the expanded agenda, so that you can see exactly what the intent is to cover. And stay safe, stay well. I appreciate you all, and have a good night.
Thank you, Judy. Good night, everyone.
Good night, everyone.